Good morning.
Good morning, everyone.
Good morning.
Some of us from Landmark, not all of us, but the ones that we could convince to come in. So anyway, today we are finally going to talk about vitamin B12. Vitamin B12 is considered one of those essential vitamins. What I mean by that is that the body needs vitamin B12 in order to work properly. B12 can be found in foods like meats, fish, and dairy. It also can be produced in a lab. It is very often taken in combination with other B vitamins. Vitamin B12 is used for many conditions like
memory loss,
Alzheimer's, helps to slow the aging process. It boosts energy.
increased concentration, and mental function.
Also, it's used in heart disease. Sorry, it was me. I think I need some B12. It's used in heart conditions. It especially helps with clogged arteries or for people who have had stents placed so that those stents don't reclog.
High triglyceride levels, male infertility, diabetes.
Nerve damage, hands and feet.
depression and mood disorders.
And many other conditions. So what should your B12 level look like? In our practice, we like to treat anything under 400. And generally speaking, between 150 and 400 is a deficiency. Vitamin B12 can be taken orally, it can be applied to the skin topically, nasally, or it also can be injected. High levels of vitamin B12 are typically not a problem. However, if somebody isn't taking a supplement and they have high levels, we're looking for some liver disease. It can be obesity, diabetes, also can be some kidney failure as well. If you take too much vitamin B12, it's not typically an issue because it's a water-soluble vitamin, meaning that it's just excreted in the urine. However, talk to your healthcare provider first about what you should be taking and how much of it you should be taking, or even if you need to have that level be drawn. So now, just another thing, if you take some chronic medications, that can actually cause you to have vitamin B12 deficiency. One of those medicines that we commonly use is colchicine. That's a gout medication. Metformin, which is a first-line anti-diabetic agent, and also a very commonly used medication, which really worries me, is proton pump inhibitors, because so many people are on them. That's a medication that decreases acid production in the stomach. And lastly, but not leastly, is ethanol, which is drinking alcohol. Now I'm going to pass it over to Chrissy. Do you have any announcements for us?
Yes. Oh, is it snowing?
No, it's not.
There it is.
It is.
Oh, no. Here it comes. So this is going to be the last week for the guesses for the Band-Aids. So you can submit them online, and we have a lot in the office. And then next Friday when we go live, we'll announce the winner of the tickets to the movies. And then we'll start a really fun contest after that.
We're all looking forward to that one. I'd like to leave you with a thought today. And that thought is, or that quote is, loving people live in a loving world. Hostile people live in a hostile world. Same world. Dr. Wayne Dyer, someone who I truly admire and I read almost daily. Have a great week, everybody.
Bye. Be safe driving.